On behalf of Accent Eye Care and Sports Vision Therapy and Dr. Gong, I would like to thank you for choosing us for your vision therapy needs. We look forward to working with you. Today I would like to talk with you about how to prepare for your first visit and what to expect when you arrive here. So on our website at www.accenteyes.com, we have some forms that are available for you to read and sign. One of them will be the vision therapy policy. This will allow you to become familiar with what our expectations are for you. There is also a goals paper that you can look at to think about the goals that you would like to achieve as a result of vision therapy. Then we are more prepared to discuss them on your first visit. You can also access videos that will show you the initial exercises that we will be assigning. It explains each of them. The exercises that you will want to look at in our videos is number 1 is fixations, 2 is pursuits, and 3 is accommodations. Those exercises will be your foundation that we build on for the rest of your therapy. Having looked at those videos, when you arrive at your first visit, we can discuss if you have any questions about how to proceed with those exercises. Now, the other thing that you'll be doing when you come is we will discuss how to approach your therapy. Our expectations for your home part of it will be to hit at least 4 days per week. Ideally, every day would be great, but we understand that schedules and other things that you have committed to make that pretty impossible for some people. But as you realize with other things, the more that you're able to put in at home, the more outcome you're going to receive from it. We will always be accessible through email and phone to help you with further questions if in between visits you have any. The other thing that you'll be receiving is a kit that includes the initial tools that most people use when they go through their therapy. There is a fee for that is explained in the policy. The tools that you have there will be used as you're progressing through. It won't be a here's everything at once kind of thing, but we'll explain them as you are progressing. Now, anything else that we add to that kit through your time in therapy will also be included in that initial fee. There will be some items that will be on a loan basis that we will give as needed. Now, the only fee would be is if there was an unfortunate incident where one of those was broken or misplaced. And so you don't have to worry about continuous fees for different tools that you might receive. All of the tools have instructions. However, we will explain them specifically to what your therapy needs will be. Dosing is just as important as any other medicine that you would receive. And so we want to be careful with how we use the things that are in your kit. This will be the kit that you receive on the first day, and inside are the tools. We would like for you to bring this with you when you come because everything's together. And if we're assigning anything new, we can just reach into the bag and pull that out and explain it. Now, if it's a child that's attending, we will have you come to this first session, explain some of the things in the bag, but then from then on out, that child will come back to the therapy room to do the 30-minute session alone, and then we will consult with you briefly at the end of the session to discuss if there's any further needs to change home therapy, to see how it's going. But again, we'll be available in between sessions if you have questions or concerns. There are instructions for everything, but as I said, we need to have specific dosing amounts of repetition and such, and how to use the specific tools. It's good to have this with you, but if you forget it, it's not a deal breaker. So we'll work with it as we need to. Patching is also going to be included in here if it is required for your therapy. And again, we will explain that as to your specific need. We look forward to working with you. One note that I wanted to add is that we do have an open therapy room. And so other therapists will be working with other patients at the same time. That's a possibility. If that is an issue for you, please let us know ahead of time so we can prepare appropriately. And we'll do the best that we can to meet what your need is.